Hello, this is Dr. Biplab Todia. In this lecture, we are going to discuss the topic of drowning. Now, coming to the definition, drowning is the process of experiencing respiratory impairment from submersion or immersion in liquid. In drowning, victims of drowning have a very slim chance of survival after immersion. The victims loses consciousness after approximately 2 minutes of immersion, and brain damage can take place after 4 to 6 minutes. In the diagram you can see there is the first step is inability to keep the airway clear, then there is submerging and breath holding, then there is aspiration of water, then there is unconsciousness, then which can lead to cardiac arrest and ultimately death. Coming to the world problem, in 2016 an estimated 3,22,000 people died from drowning. Drowning is the third leading cause of unintentional injuries or death. The low and middle income countries account for 90% of unintentional drowning deaths. So it covers 90% of drowning deaths by the low and middle income countries. Over 50% of the world drowning occurs in WHO Western Pacific region and WHO Southeast Asia region. India belongs to the WHO Southeast Asia region. So this region, Southeast Asia region, then there is Western Pacific. So both of them account for almost 50% of drowning cases. Now, India and China together constitute 43% of drowning deaths and 41% of global dailies. Here in the chart, you can see that drowning comes under unintentional injuries and around 322 deaths, and it constitutes 0.6% of the total deaths. Risk factors. There are risk factors which include age, gender, access to water, and there are other risk factors. Now coming to the age, the children under 5 years of age have highest drowning mortality rates worldwide. Gender, males have 2 times more mortality than females. And this high drowning rates in male is due to increased exposure of water, riskier behavior like swimming alone, drinking alcohol before swimming alone, boating. Males are more likely to be hospitalized than females for non-fatal drowning. Access to water. Individuals with occupations such as commercial fishing, who are using boats in low income countries, children who live near open water sources like ditches, pond, irrigation channels, and pools. Now coming to the risk factors, the infants left unsupervised or alone in a bathtub. Now I will give you an example of real life experience which I experienced during my emergency duty. One of the mother came with her child and she said the child is unconscious. So after that I checked the child's pulse rate. I ausculted the heart for heart rate and also checked the corneal reflex, and the pupil were also dilated. So the corneal reflex was also absent. There was no heart rate, there was no pulse rate. So the child was dead. So when I asked about the history, they told that the child was found in one of the tub. In rural India's, there is behind the kitchen or the washing area, they have a tub where they keep water for washing their utensils. So a I think below 2 years child who was just maybe playfully get into the tub or fell down or something like that, even though the mother was there and grandmother was also there, the child still died. So this is the real life experience which I am going to which I experienced of a drowning of a small child in a bathtub. Now coming back to the lecture, as I told you, infant left unsupervised alone in a bathtub. There is unsafe or overcrowded transportation vessels, alcohol use near water, medical condition like epilepsy also can are the risk factor. Now tourists who are unfamiliar with local water is also riskier. Floods and tsunami are also risk factors. Now coming to the prevention, there are three ways you can prevent this drowning. One is engineering method, second is laws or regulations, then there is community education. Now, engineer methods, this include development and implementation of safe water system, building four-sided pool fences preventing access to standing water, creating and maintaining safe water zone for recreation, covering of wells and cistern, emptying of buckets and bath and storing them upside down. Laws and regulation include laws and regulation which target risk factors include like regular safety checks of transportation vessels, laws on alcohol use while boating or swimming. Education and awareness, individual and community education is needed on drowning awareness, learning about the water survival skill and ensuring presence of lifeguards at swimming areas. Thank you for watching my lecture. Please like, share and subscribe the channel for more such kind of videos.